everyone. Welcome back to the vlog. I'm Kathryn Todd, and I serve as the Vice President, Provincial Clinical Excellence. And today I have the great honor of filling in for Verna. I'm happy to be here this week as we are celebrating National Volunteer Week. More than ever, we are incredibly grateful to have such a dedicated group of volunteers who are willing to share their time and talents with our patients and our staff. Our volunteers are resilient and have adapted to meet the many challenges that we have all faced over the last year. In March of 2020, most volunteer programs closed during AHS's initial response to the COVID-19 pandemic. Programs started to reopen last summer, and since then, some of our volunteers have returned to their roles at AHS sites, while others have found ways to volunteer remotely. I also know that many volunteers have taken a break from us, either because their volunteer programs have stayed closed or because they've taken some time off to focus on their own health. Whatever your situation, please know that you are always part of the AHS family, and we truly appreciate you. So joining me today to talk about their experiences are three of AHS's amazing volunteers. Duncan Thomas, a volunteer with the Renal Dialysis program at the Red Deer Regional Hospital Center. Cheryl Pigula, a Wayfinder volunteer at the Medicine Hat Regional Hospital, and Jan Ellis, a volunteer with the No One Dies Alone program in the Calgary zone. Welcome all, and thank you so much for joining me today. So Duncan, let's start with you. How did you come to volunteer with Alberta Health Services? And please tell us about what you do in that role. For example, things like where do you volunteer, how you got started, and the kinds of things you do.
I started volunteering at Red Deer Regional Hospital in May 2019. I originally started in the emergency department, working as a kind of general assistant there, really looking for some more clinical exposure, trying to decide what I wanted to do as a future career. And I thought that would be a great way to really experience the hospital setting and also get some insight into the different professions. And I thought it was really a nice way to be engaged with the community. I eventually took up a position as a rec therapy assistant shortly before the pandemic started, working with some of the patients on some of the rehab programs, just going for walks with them, having conversations if they were maybe bedridden. That was really a very heartwarming experience and very much a learning experience in terms of how to be patient with people and really put myself out there, understand where they're at in their healthcare needs, and really learn more about all the professions as well there, because in the rehab department.
Thanks, Duncan. Cheryl, over to you. I understand that you've been back and volunteering with us since the Medicine Hat Regional Hospital was able to bring volunteers back in July. How has your volunteer experience changed during the pandemic? Can you tell us a little bit about how your role has changed, or are there any new procedures and policies in place?
I have come back since they've allowed us to come back, and it's been great. The role is basically the same, except I believe now there's more of a focus on doing everything in a safer manner. So we have to make sure that, you know, the people that we're helping are getting to where they need to go, and yet in a safe way, and that they're comfortable. And that's a big thing right now, is making sure that people are comfortable in the hospital, because it's always been a different experience for people. It's not the nicest thing in most cases to come to the hospital. So we've always tried to make sure that we help people in that way. But now, you know, we focus more on safety. The changes to it, I think we support the greeters, we support the hospital in general more. So there's a lot more cleaning, there's a lot more ensuring that, you know, people have masks and that type of thing. But the role still is about helping people and making it as least stressful as possible for the person that we're helping. So.
And Jan, over to you now. So you're a volunteer with our No One Dies Alone, or NODA program in the Calgary zone. How did you get involved with that program, and what do you do in that role?
Well, my experience with Alberta Health Services began not with NODA, but with the Caring Hands program in 2018. Caring Hands is a fantastic program that supports families with twins and triplets in their homes for the first 2 years of life. Really busy and a lot of fun, as I'm sure you can understand. Volunteering for that program really opened my eyes as to just how much of a difference a volunteer can make. I then began looking for additional opportunities with AHS, and that's what led me to No One Dies Alone in 2019, which in many ways is the opposite of Caring Hands. No One Dies Alone, or NODA, is an outstanding program supporting hospital patients that have few, if any, family or friends in what may be their final 48 to 72 hours of life. I was drawn to NODA after having been there for the deaths of each of my parents and my mother-in-law, and truly believe that being there provided comfort. To be able to provide this comfort to those who may not have anyone struck me as an excellent opportunity to help. It's now been 2 years since I began volunteering for NODA. Sometimes patients are awake and conscious, and sometimes they're not. I always assume the patient is aware I'm there and that they can hear me. For each person, I try to determine how best to provide comfort. That could be holding their hand, it could be reading poems. Robert Service and nature poems, I think, are welcomed. Playing nature, classical music from my phone, talking to them quietly, or just sitting there. Patients, as able, and hospital staff are always appreciative and welcoming of NODA support. I believe the No One Dies Alone program is outstanding and really contributes to the betterment of our communities.
I understand that during the pandemic, you and some of our other NODA volunteers have been supporting the Medical Assistance in Dying program. Could you explain for us the roles you've taken on here?
Yes, when asked to provide support for medical assistance in dying, or the MAID program, I wanted to help, but really did not know what to expect or many details about the program. After receiving training on the program, I began witnessing patients who are very ill sign documents requesting medical assistance in dying. While it's a really small role, it is one of the many checks and balances the program has in place. When the patient is signing the documents, there's typically 2 or 3 people from AHS there, a medical professional who facilitates the process, and 1 or 2 volunteers like me. Often the patient is there with a family member. I guess there's a couple of things that strike me about what I have seen since I started volunteering for MAID. First, the patients are always welcoming to us and very grateful that the option for MAID exists. They appreciate that we are there to help as they explore that potential path. Sometimes we hear stories of family and are invited to look at pictures. The feeling in the room is calm and respectful. I have yet to see a tear. The second thing that strikes me is the gentle, kind, but very direct communication between the facilitator and the patient. The facilitator ensures the patient understands all the steps and requirements of the program, and that the patient, has full control to stop it at any point. My belief is that some patients want to control what they can of what remains of their lives, and MAID provides an option. Experience with NODA for me has helped provide me with a perspective for MAID that I may not have had otherwise. I believe using volunteers that are familiar with both programs provide a natural fit and connection to those suffering. I truly believe that both NODA and MAID are caring and compassionate components of our healthcare system, and that we are fortunate to have them. And I'm very grateful to be able to help in my little way.
Duncan, back with you now. Why was it important for you to return to volunteering when programs reopened? Can you just give us a glimpse into that?
When the volunteering positions first started up, I definitely really wanted to jump right back into it for a couple of reasons. First for me, it was a sense of routine to get back into amidst all like the uncertainty of the pandemic. It really helped having that set time every week where I could just go in, have that experience with people, and do it in a safe manner, mask and goggles, gloves, lots of sanitizer. It was really healthy for my own mental health, but then as well, a big motivating factor was it's also the pandemic. The healthcare system is very stressed out. A lot of people are overworked, and it was a great way for me to lend an assisting hand again, and really try and fill in any gaps that may need to be filled in.
Cheryl, last question is with you. What message would you like to share with your fellow volunteers during National Volunteer Week? Or is there any encouragement you might want to share with other volunteers?
I'm very thankful to volunteer with such a great group of people. And, these people have stepped up and showed up day in and day out, and for no other reason than to help people. And it makes me very proud to be part of such a group. And, to anybody that hesitates to volunteer, just step in, do it. It's a wonderful thing to do. And like I say, the people I work with are truly amazing, and I'm grateful to be there.
I want to thank you all for joining me today and allowing me to spend this time. It's been a real privilege for me to hear from you and hear about the roles that you're playing and the important things that you're doing to serve Albertans. And I also want to thank all the volunteers across the province for continuing to share your time, talents, and effort to support Albertans. Although we can't be together right now, I am looking forward to the day when we can celebrate again safely together. I encourage all our staff and physicians to share your appreciation for our amazing volunteers through our Sharing the Love page or on thanksforcaring.ca. I really enjoyed my opportunity to guest host this week, and thank you all for watching. Until next time, please stay safe and stay well.
Together, we do amazing things every day.